Reduction is not just one strategy, it's a set of strategies aimed at reducing the negative effects of drug use. Part of that is safer or managed use, and that can look a number of different ways. But tonight, I talked to advocates about overdose prevention centers and what that would look like in Connecticut. The opioid epidemic continues to take lives every single day. In Connecticut alone, there were 1,524 drug overdose deaths in 2021. In the search for answers on how to try to stop this, advocates of overdose prevention centers want their voices heard.
An overdose prevention center is just in line with how we treat every other illness in America. It's basically just playing catch up to the accepted standard for treating any other type of patient.
Dr. Daniel Kerekes is a surgery resident at Yale New Haven Hospital. He's calling for Connecticut to take the lead on opening these centers. The concept is they provide a clean, safe space for people to use drugs, with staff on hand ready to step in to prevent an overdose. Right now, they only exist in the U.S. and New York City, but have existed in other countries for years.
There are over 100 of these worldwide, and they've been operational since 1986. And there have been 0 deaths due to opioid overdose in one of these centers. It decreases overdoses, it decreases the number of regional ambulance calls, it decreases the number of infections.
What does exist in our state are harm reduction facilities and syringe service programs, like the Drop in Hartford, run by the Connecticut Harm Reduction Alliance.
Naloxone, education around fentanyl test strips. Again, it's a non-judgmental space.
Advocates say some of the concerns they often hear is that overdose prevention centers would encourage drug use or that they would bring crime to an area, and that the idea of something like this is just uncomfortable to many. But they say other approaches haven't worked, and it may be time to try something new.
These are public health responses. The most effective public health responses are not favorable. We're failing, and it's primarily because of fear. We have to think outside the box.
Now, right now, there is no proposal to bring these centers to Connecticut, but the state legislature's Public Health Committee did hold an informational hearing on them just last month.